So cardiac glycoside we use to treat the atrial fibrillation. We use to treat atrial flutter or congestive heart failure. The most common cardiac glycoside we use digoxin or digoxin. We're going to talk about how digoxin work, digoxin common side effect, toxicity, and nursing implementation. Before to start the pharmacology, I'd like to explain what are the maladaptive compensatory response to the failing of the heart. So when heart is failed or does not work well, but our heart try to compensate with the system. So the cardiac remodeling reduce the cardiac output. And when cardiac output reduce, how heart try to compensate with the system, like cardiac dilatation occur, activation of the sympathetic nervous system, or activation of the renin-angiotensin in aldosterone system, and also retention of water and increase the blood volumes. This is the compensatory system. When this is occur, heart rate go up, venous pressure go up, and arterial pressure go up. And this I want to explain from this flow chart. When heart failed, the normal compensatory mechanism means when heart doesn't work well, cardiac output go down. When cardiac output go down, decrease the carotid sinus firing, and it stimulates sympathetic discharge, and sympathetic system increase the force of action of the heart, increase the heart rate, increase the preload. And when cardiac output go down, renal blood flow also go down through the kidney. And this kidney secretes renin. And when renin release increase, it increase the angiotensin 2 formation. And angiotensin 2 do the remodeling of the heart, increase the afterload, and increase the preload. So this is together we call positive inotropic mechanism. When heart does not work, body compensate with the system. Body try and heart rate go up. But if the body does not compensate or not enough to compensate, we need medication. And this is the cardiac glycoside, particularly digoxin we use. So cardiac glycoside inhibit sodium potassium pump and thus increasing intracellular calcium, which causes the heart muscle fiber to contract the more efficiently. Cardiac glycoside produce a positive inotropic action, which increase the force of myocardial contraction. Cardiac glycoside produce a negative chronotropic action, which slow the heart rate. Or cardiac glycoside produce a negative dromotropic action that slow the contraction velocity through the arteriovenous or AB node. And also increase the myocardial contractility, that is increase the cardiac, peripheral, and kidney function by increasing cardiac output or decreasing preload, improve the blood flow to the periphery and kidneys, decrease edema or increasing fluid excretion. As a result, fluid retention in the lungs and extremity is decreased. The continuity of digoxin. Cardiac glycoside are used second line for heart failure. And this medication affecting the renin, angiotensin, aldosterone system are used more often. The cardiogenic shock, atrial tachycardia, atrial fibrillation, and atrial flutter. This is the indication of cardiac glycoside. It is treat the atrial tachycardia, atrial fibrillation, cardiogenic shock, or atrial flutter. And they are used less frequently for rate control in atrial dysrhythmias. And this medication are contraindicated in those with ventricular dysrhythmia or second or third degree block, and should be used with some precursor in the client with renal disease, hypothyroidism, and hypokalemia. So it is very important when we work as a RN or LPN or healthcare provider implication. So if a patient needs cardiac glycoside or digoxin, it is important to monitor apical pulse for 1 full minute. And do not give if the pulse is less than 60 in adult or less than 90 in child or less than 70 in older client. Also, we could monitor electrolyte, like digoxin can cause hypokalemia, hypomagnesemia, and hypercalcemia. And hypokalemia, hypomagnesemia, and hypercalcemia increase the risk of digoxin toxicity. It is important to monitor. Now go for the side and adverse effect. They can cause anorexia, nausea, vomiting, and diarrhea. We can call GI upset. And bradycardia or visual disturbance like double vision is called diplopia, or difficulty of vision, blurring of vision, yellow vision, or photophobia. So this is the sign of toxicity of digoxin overdose. Sometimes headache, fatigue, weakness, and drowsiness, right? An early sign of digoxin toxicity present as gastrointestinal manifestation or gastrointestinal upset, like anorexia, nausea, vomiting, and diarrhea. Then heart rate abnormalities like bradycardia, visual disturbance like diplopia appears. So what we could monitor or intervention? Monitor for toxicity is evidenced by anorexia, nausea, vomiting, visual disturbance, and dysarrhythmias. Monitor the serum digoxin level, electrolyte level, renal function test. Why electrolyte level? Because when potassium level go down, magnesium level go down, but calcium level go up, it precipitates the digoxin toxicity. The optimal therapeutic range for digoxin is 0.5 to 0.08 and increase the risk of digoxin exist in the client with hypercalcemia, hypomagnesemia, hypomagnesemia, and hypothyroidism. They increase the risks of toxicity. So they are precipitating factor. And monitor the potassium level if hypokalemia occur or potassium lower than 3.5 milliequivalent, we could notify healthcare provider. Instruct the client to avoid over-the-counter medication or monitor the client taking a potassium-losing diuretics or corticosteroid closely for hypokalemia because hypokalemia can cause digoxin toxicity. But next, so note that the older clients are more sensitive to digoxin toxicity. Why? Because their renal system not active as like young patient. It reduces the excretion abilities. Also advise the client to eat foods high in potassium to prevent hypokalemia, such as fresh foods or fruits juices, vegetables, and potatoes. We monitor the apical pulse for 1 full minute. If the apical pulse rate is lower than 60 beats per minute, the medication should be withheld and the healthcare provider notified. And educate the client how to measure the pulse and notify healthcare provider if the pulse rate lower than 60 or more than 100 beats per minute. And also educate the client the sign and symptom of toxicity. If cardiac glycoside toxicity or overdose occur, we give them antidote, and it is called digoxin immune fib is used to avoid the toxicities. And now here